If you love your penis or simply want it to stay healthy, this video is absolutely for you. I'm Dr. Arlina, and today we're diving into the things you should never do to your penis. You might think you already know the basics, but trust me, after years of treating patients in clinic, I've seen how small habits can lead to big problems, and some of them are surprisingly common. Before we get into the list, I want you to understand why this topic matters so much. Your penis is more than just an organ. It's a window into your overall health. Changes in its function can reflect issues with blood flow, hormones, nerves, and even emotional well-being. I often tell my patients, your penis usually whispers before it screams, meaning mild symptoms can be early warnings. In this chapter, I want to set the stage. Think of your penis as a highly specialized system, delicate, responsive, and deeply connected to the rest of your body. When something goes wrong, it's rarely random. There's almost always a reason and usually a fix. And yes, some of the mistakes we'll discuss today are things men do without realizing the consequences. Others are myths that simply refuse to die on the internet. But by the end of this video, you'll know exactly what to avoid and why. If you find this kind of content helpful, don't forget to subscribe and turn on notifications so you never miss important health. One of the most common mistakes men make is assuming their penis will simply figure things out on its own. I can't tell you how many times patients come to me months or even years after noticing changes, only to say, I thought it would go away. Your penis is actually one of the most sensitive indicators of your internal health. When something shifts, whether it's firmness, sensation, timing, or appearance, it's rarely random. It's your body's way of tapping you on the shoulder. In my clinical practice, I've seen subtle symptoms turn into bigger issues simply because they were ignored. Mild difficulty maintaining erections can hint at cardiovascular concerns. A curve might signal early Peyronie's disease. Redness, swelling, or discharge can point to infections that are usually easy to treat when caught early, but waiting often makes treatment more complicated. That doesn't mean every small change is alarming. Sometimes it's stress, dehydration, or a rough week. But if something persists for more than a couple of weeks, or if your intuition says, this isn't normal, it's time to pay attention. You deserve clarity, not worry. Think of this chapter as your reminder that early action is powerful. Your penis isn't just reacting, it's communicating. And listening early protects your confidence, your relationships, and your long-term health. Stay with me because in the next chapter, we'll talk about one of the biggest modern dangers I see men fall for. DIY methods claiming results but rarely deliver. Let's talk about one of the most concerning trends I see in men's health. Do-it-yourself methods that promise quick fixes for size, performance, or appearance. As Dr. Arlina, I completely understand why these methods feel tempting. When you're worried about your penis, anxiety can push you toward anything that seems fast or secret. But in medicine, shortcuts often create more harm than help. Over the years, I've treated many patients who tried home techniques they found online, stretching devices, pressure-based exercises, strange oils, or homemade rings, and almost all of them ended up with injuries that could have been entirely avoided. These methods can damage the delicate blood vessels and tissues that allow erections to happen. Some men develop bruising, numbness, curvature, or long-term erectile issues. A few even require surgical repair. The truth is, if a method truly worked and was safe, it would already be part of standard medical care. The fact that it isn't tells you everything you need to know. I want you to remember something important. Your penis is not a DIY project. It deserves proper care, proper information, and proper medical guidance. If you're concerned about size, performance, or function, talk to a professional instead of risking your health. There are legitimate treatments available, but none of them involve untested tricks from the internet. When it comes to penis health, hygiene matters more than most people realize, but not in the way many expect. As Dr. Arlina, I often see two extremes: men who don't clean enough and men who clean way too aggressively. Both can lead to unnecessary problems. Your penis has delicate skin, and while keeping it clean is essential, treating it like a stubborn stain on a kitchen counter is definitely not the right approach. If you have a foreskin, gently pulling it back and rinsing underneath with warm water is usually enough. This helps remove natural buildup that can cause irritation or infection. The key word here is gentle. You don't need harsh soaps, strong fragrances, or vigorous scrubbing. In fact, those things often cause the very irritation you're trying to avoid. Many men come to me worried about redness or dryness, only to discover their soap was the culprit. On the other hand, skipping hygiene altogether can allow bacteria or yeast to thrive. That can lead to inflammation, pain, odor, or even difficulty retracting the foreskin. These issues are common, but preventable with simple, consistent care. Remember, cleanliness should feel comfortable, not harsh. Think of your routine like watering a plant. You provide what's needed without drowning it. And here's a small professional tip. After washing, make sure the area is dry before putting on underwear. Moisture trapped in warm spaces can lead to irritation or infections that are easily avoided. As a urologist, one of the most important things I teach my patients is this: your penis will almost always warn you before a serious issue develops. The problem is that many men dismiss those early signals out of embarrassment, fear, or simple wishful thinking. As Dr. Arlina, I want you to know that paying attention and acting early can make all the difference in your long-term health. So what exactly counts as a red flag? Sudden pain, persistent discomfort, new lumps, sores, swelling, curvature, discharge, or difficulty with erections are all signs that something needs evaluation. None of these symptoms automatically mean something dangerous is happening, but each one deserves attention. For example, blood in the urine might indicate an infection or a stone. A new sore could be an easily treatable condition or an early sign of something more serious. An unexplained curve may signal early scar tissue formation. These are issues that respond far better when addressed early rather than ignored. And here's something many men don't realize. Avoiding medical care often makes outcomes worse, not because the condition is severe, but because small problems grow when left alone. I've had patients come in after months of worrying silently, only to learn that a simple medication or small procedure could have helped them immediately. You deserve peace of mind, not silent stress. If something looks, feels, or functions differently, and especially if it persists, talk to a healthcare professional. You're not being dramatic, you're being responsible. When it comes to sexual activity, one of the biggest factors in penis health is control, both physical and situational. As Dr. Arlina, I've treated many preventable injuries that happened simply because things moved too fast, too forcefully, or without enough awareness. Pleasure and safety are not opposites. In fact, they work beautifully together when you understand how to protect yourself. First, let's talk about safety from infections. Using protection isn't just about preventing pregnancy, it safeguards your long-term sexual health. Condoms come in various styles and materials, so experiment to find what feels best for you and your partner. When you're not worried about sexually transmitted infections, intimacy becomes more relaxed, connected, and enjoyable. Now on to physical control, which is where many serious injuries can happen. Penile fractures, for example, occur when the erect penis bends suddenly or forcefully, often during vigorous sex. This is a true medical emergency. Symptoms usually include a sharp sound or sensation, immediate pain, and rapid swelling. Getting treatment early dramatically improves outcomes. One of the simplest ways to prevent this is by maintaining awareness of positioning and movement, especially during high-energy moments. Holding your partner's hips or adjusting angles can make a big difference. And don't forget lubrication, your best friend for reducing friction and preventing micro tears or irritation. Whether natural or added, lube enhances comfort and helps protect sensitive tissue. One of the most overlooked factors in penis and testicle health is temperature. As Dr. Arlina, I often remind patients that the testicles live outside the body for a reason. They need cooler conditions to function optimally. When they're consistently exposed to heat, everything from sperm production to hormonal balance can be affected. Many men don't realize how common these heat sources are in daily life. Hot tubs, steam rooms, or even prolonged laptop use directly on your lap can warm the area far more than you think. Over time, this can contribute to fertility challenges or subtle changes in sexual function. Now, this doesn't mean you can never enjoy a relaxing soak or a spa day. Moderation matters. Limiting how often and how long you expose your genitals to high heat is the key. Another everyday tip: avoid keeping your phone in your front pocket for extended periods, since electronics produce warmth and sometimes low-level radiation that can add unnecessary stress to sensitive tissues. Tight clothing can also trap heat and moisture, creating an uncomfortable environment that may promote irritation or infections. Choose breathable fabrics, especially during workouts or warm weather. Think of this as creating the right climate for your reproductive health. Just like plants thrive in the right temperature range, your testicles function best when they're kept cool, comfortable, and well ventilated. As we wrap up this important conversation, I want you to take a deep breath and remember something essential. Your penis is not fragile, but it is responsive to how you care for it. I'm Dr. Arlina, and my goal is always to give you clarity, confidence, and practical steps you can use immediately. Throughout this video, we've explored the habits that protect your sexual health, avoiding DIY whisks, staying aware of early signs, practicing safe intimacy, keeping the environment cool, and maintaining gentle hygiene. Each one of these actions supports not only your penis, but your overall well-being, because sexual health is deeply connected to cardiovascular health, hormone balance, emotional wellness, and lifestyle choices. The good news? Most problems are preventable, and almost all are treatable when addressed early. You don't need to feel embarrassed, ashamed, or alone. Your concerns are valid, and seeking help is a sign of strength, not weakness. I want you to approach your health with curiosity rather than fear. Your body is always speaking to you. Listening is an act of self-respect. If you take only one message from this video, let it be this: you deserve to feel confident, healthy, and informed at every stage of life. Small, consistent habits make a massive impact over time. Thank you for spending this time with me and prioritizing your health. If you found this video valuable, please subscribe, like, and share it with someone who might benefit. I'm here to support you, always. Stay well, stay aware, and most importantly, take care of yourself.